I'm Sarah Larcombe, a PhD candidate at the Department of Microbiology and Biomedicine Discovery Institute at Monash University, where we study the pathogenesis of infectious diseases, including antibiotic-associated diarrhoea. AAD usually occurs following treatment with one or more broad-spectrum antibiotic, which can unintentionally disrupt non-target organisms, including protective species in the gut. This can then lead to infection with opportunistic bacterial pathogens, which damage the gut and cause diarrheal disease. AAD is a complex disease that is influenced by the host, the infectious agent, and numerous clinical factors. The most common infectious cause of AAD is Clostridium difficile, but it still only accounts for up to 25% of cases. Other bacterial pathogens have also been associated with AAD, such as Clostridium perfringens, Staphylococcus aureus, and Klebsiella oxytoca, which, like C. difficile, all cause toxin-mediated gut damage. Because of a lack of research in the area, we don't know a lot about infections that result from microbiota disruptions from pathogens other than C. difficile, but we do have evidence for the involvement of non-C. difficile pathogens in AAD and evidence for how these organisms can cause gut disease. Unfortunately though, it's not clear what the prevalence of these organisms is in AAD because they're not often screened for. The overuse of broad-spectrum antibiotics in recent years also complicates AAD since it leaves patients susceptible to infection with AAD pathogens, many of which are resistant to multiple antibiotics. In this paper, we re-examine the clinical and research efforts investigating non-C. difficile AAD pathogens, including their clinical associations with AAD, associated risk factors, specific mechanisms of pathogenesis, and co-infections with multiple AAD pathogens. Research in recent years has provided major breakthroughs in our understanding of gut health and the role of normal microbiota in health and disease, which provides a timely context to revisit the topic of AAD and refocus research efforts to include non-C. difficile AAD pathogens. In a clinical context, when AAD is suspected but C. difficile isn't found, other known and emerging AAD pathogens should be screened for, and together this will lead to an increased understanding of AAD and better clinical outcomes.